Hello and welcome back to GP Video Podcast by Nadia. So today while doing telehealth, I wanted to make a short video podcast on a very important message. Sometimes my patients ask me when I start put them on some anti-diabetic medications that why am I on a anti-diabetic medication when I am not a diabetic? So the answer to this is very interesting. The interesting bit about the anti-diabetic medications is these medications are so good, so nice that some of them are actually used for other purposes apart from type 2 diabetes itself. So if your GP is putting you on anti-diabetic medications when you are not a diabetic, it can mean a lot of things. So for example, I've got this interesting two paragraphs on why am I on an anti-diabetic medication while I'm not a diabetic. So people are sometimes prescribed diabetes medications even when they don't have diabetes because these drugs can effectively and efficiently address other health concerns. For instance, Forxiga or dapagliflozin is a medication originally for managing type 2 diabetes, but it's also used to treat chronic kidney disease and heart failure. So you could be a diabetic and you could have chronic heart disease or heart failure, and then definitely you're going to use dapagliflozin or Forxiga. But if you're not a diabetic, then it means that it could be for your chronic kidney disease or for your heart failure, or for if you have both of them, God forbid, then for both of them. So by promoting the excretion of excess glucose through urine, it helps reduce the strain on the kidneys and lowers the risk of heart-related disease. This dual functionality makes it an appealing option for those with overlapping health challenges. Similarly, metformin, this is my favorite drug, my favorite medication, a staple in diabetes care, is widely used to tackle obesity and polycystic ovarian syndrome. So it means that, I put a lot of my patients who either suffer from polycystic ovarian syndrome or who are overweight, just to help the other medications for weight management to help them. For example, if I put patients on, let's say Wegovy, I put them usually concomitantly on metformin as well. And I also put patients who are pre-diabetic. So there is a condition called pre-diabetic or impaired fasting glucose as well, or people who are insulin resistant, because you know what, the first step in becoming a type 2 diabetic is being insulin resistant. Your body is producing insulin, but you are is producing insulin, actually producing a lot more, because the body is insulin resistant. That is actually the basic difference between type 1 diabetes and type 2 diabetes as well. Type 1 diabetes, you are insulin deficient. You don't have insulin. That's why you are type 1 diabetic. In type 2 diabetic, you do have insulin. Actually, you have a lot of it because your body is resistant to insulin. What is insulin? Insulin is the hormone that is secreted by pancreas, and it actually helps manage the blood sugar levels. It promotes the sugar from blood to go into the cells. So if you are either insulin deficient or insulin resistant, in both cases you can become diabetic. So metformin is used for insulin resistance, pre-diabetes, when you have impaired fasting glucose levels but your HbA1c is still normal, and then in obesity, managing obesity, and of course polycystic ovarian syndrome. And the reason it's used in polycystic ovarian syndrome is again insulin resistance. So what it does is it enhances insulin sensitivity, which can lead to weight loss and improved hormonal balance. So this is another use of it, like this is another mechanism of work for it in polycystic ovarian syndrome, making it particularly beneficial for women with PCOS. Other medications like semaglutide or Wegovy, initially developed for diabetes, are now gaining attention for weight management. It works by mimicking a hormone that reduces hunger, which can be a game changer in obesity treatment. So basically what it does is it basically delays the gastric emptying, and in that way it actually works on the brain receptors, and in that way you feel less hungry. These examples highlight the expanding role of diabetes medications in addressing a broader spectrum of health issues. However, it's crucial to use these medications under medical supervision to ensure they are safe and effective for your specific health needs. One of the things that I usually tell my patients when I put them on metformin when they are not diabetic is try and take it at night time. Because what happens is when you take metformin, of course it's an anti-diabetic medication, it's going to lower your sugar levels. And if you're using it in the morning, I actually learned this by tackling with patients. So patients that I had started on metformin 500 milligram daily, some of them came to me and they said that we feel extra tired in the mornings since we have started metformin. And then I realized that yes, because they are not diabetic, they are either pre-diabetic or insulin resistant, or they have other problems for which I have started them on metformin. Because metformin lowers the sugar levels and their sugar levels are either normal or high normal, or a bit abnormal. So what happens is that their sugar levels go down and they feel more tired and lethargic during the daytime. So what I've asked them to do is to do take metformin at night time, and that has actually worked really well, because you know what, you take it half an hour before bedtime, and it lowers the sugar levels during the night time, and then you are asleep already, so you don't feel tired and lethargic, and you give the medication its chance to work for you. Alrighty, that was the small video podcast for me today. See you guys next time.